Afternoon, everyone. My name is Maggie Titterington. I am president of the Chamber for Shirt-Cibolo-Selma area, and on behalf of eESI and Sheila, I would like to welcome you to Reengaging Employees and Preparing for Employees to Return to Work. As I said, please keep your audio on mute. We will allow for a chance to have a few questions at the end of the presentation, and Sheila will also be giving me the slide deck so that I can forward it on to you after this presentation. So I would like to tell you a little bit about Sheila. Sheila Price, she is an HR business partner with eESI, which stands for, I'm looking it on here, and I should have Employer Solutions Incorporated. Sorry about that. I think Terry is going to kill me. So anyways, she has been with them for over 2 years, but she has over 15 years of experience. Her passions are educating and assisting others in all areas of human resources. She holds a volunteer position as the 2020 Membership Director for the San Antonio Human Resources Management Association and the local food bank. So with that, I want to turn this over to Sheila. Sheila, welcome, and thank you so much for doing this today.
Thank you, Maggie, very much. I'm honored to be able to present to you all today and honored that eESI is also able to help with this. Thank you very much to the Chamber, and thank you everyone for taking time out of your day to join us today. As Maggie mentioned, we will be going over a few things today. Oh, sorry. We will be going over a few things today. We will be able to allow you to ask questions at the end, or feel free to use the chat box above or below, depending on where that is on your screen. So just to kind of cover what we're going to go over today on today's agenda, we're going to evaluate when to reopen and what steps should you take to do that. We're also going to evaluate who and when should you bring back to the workplace. Also, what happens if an employee refuses to return to work? That's kind of a hot topic right now. And also, maybe some benefits that you need to take into consideration in some of your planned documents that you may need to take into consideration before you allow the workforce back. Also, once you've decided to bring your workforce back, what are you going to do to keep your work area safe and healthy? And also tips on how to re-engage your employees. So as Maggie mentioned, we have a lot of information to go over today. So as I mentioned, feel free to ask your questions below. Keep in mind the situations and the laws are changing daily. Before we started today's presentation, we were just talking about how late last night, San Antonio amended the plan to let a few more businesses open. And so we'll talk about that a little later in the presentation. As Maggie mentioned, the slides will be available, and we'll send those out. We're also going to send out some other information for you, so there's the checklist and other things like that. And so as a caveat to most webinars, I want to let you know that this is not suitable for legal advice. So I encourage you to speak to your legal professional or your HR expert if you have any questions that maybe we didn't cover, or if you have some more in-depth questions about today's presentation. So let's dive into it. So what do you need to do to evaluate when to reopen? So a couple of advice for you is to involve all members of management. Involving all members of your management team may bring up some new ideas or issues that maybe you didn't think of before you are reopening the business. So make sure you include everyone in that decision. Also make sure you're monitoring local, state, and federal websites for closure information. As I mentioned, San Antonio made some changes late last night to allow some other businesses. Also, check websites such as the CDC, the EEOC, and OSHA.gov. Those are some great websites to give you some tips and tools on other things to do before you decide to reopen your business. One key factor that you do want to take into consideration is if you applied and were approved for the Paycheck Protection Program, remember that you have until April 30th to restore your salary and to restore your employment levels. I don't want to go into that too much, so check with your lender or your attorney on specific details on how to do that and how many people to bring back and whatnot. So check with your lender on that information. So one example that you could use to try to figure out how to reopen your business is to use the state of Texas's opening phases example. So what they've done is previously the stay-at-home order in San Antonio was supposed to end on April 30th. A couple weeks ago, or actually earlier, either this week or late last week, they extended the stay-at-home order here in San Antonio until May 19th. However, in Guadalupe County and Comal County, it did expire on April 30th. So I guess that's kind of the hard thing for the chamber members, is because some of you are in certain different districts or certain different counties. So you may want to check with each county's website, but a good rule of thumb is right now, San Antonio is kind of in phase 1 and phase 2, but Guadalupe and Comal County would be in phase 2. So phase 1 is the current stay-at-home work order. Phase 2 is a slow, gradual reopening that they're going to test for 14 days or 2 weeks. And then if there is no spike in cases from what they've said, it's supposed to move to phase 3 and allow for a gradual, more easing of restrictions on other businesses to open. And then, of course, stage 4 is going to happen whenever COVID is no longer a threat. Between you, me, and the fence post, I don't know if that's ever going to exist, but hopefully it will. And let's keep our eyes on the horizon, and hopefully it will. Of course, there's been talk out there that it's going to resurge in the fall, so hopefully that doesn't happen. But if we do, hopefully we all have our game plans together and we know what to do. So a little bit more on phase 2. As I mentioned, San Antonio and Texas has allowed openings of restaurants and some other businesses to open at 25% occupancy. Many businesses and retailers have come out saying that this is really hard to control, the 25% occupancy. So several employers have chosen not to reopen. So that's a good rule of thumb. As an employer, you do not have to reopen just because the state of Texas is saying that you can. It's up to you. You own your business and you're allowed to make your decisions. So as I mentioned late yesterday, San Antonio mayor came on and said that as of May 8th, cosmetology places can reopen. So barbershops, nail salons, tanning salons can now open as of May 8th. They are still under the 25% occupancy rule. And as of May 18th, gyms can reopen. So not gyms the restaurant, gyms like as in working out Gold's Gym, just so y'all know. So had to put that caveat there. And one rule of thumb you can also use, or to further assist you in reopening, is Texas has created a handbook. And so you can see the website down here on the slide. And as Maggie mentioned, we'll send the slides out for you to be able to get to that website here. So now you've considered reopening. So now let's go to who and when should you bring back. So there are a lot of things that we say in HR, but one thing you've probably always heard as HR people is document, document, document. So document your plan for reopening. This is going to save you in a lot of different areas. It's going to save you, hopefully this never happens to you, but it's going to save you if anybody ever tries to file a claim against your company for discrimination because they weren't brought back to work, but somebody else was brought back to work, things of that nature. So definitely document your plan for reopening. How are you going to do it? Who are you going to bring back? And what steps are you going to take? Also, communicate with your employees the plan for reopening, your procedures and your policies for cleanliness in the office. It has been proven that employees who have a return to work plan are more engaged and reduce turnover. Make sure you disinfect all your areas. You can visit different websites such as OSHA or the CDC for certain guidelines on chemicals that you can use and can't use for disinfecting your areas. But if you're unsure how to disinfect or what to disinfect, I would consider hiring a professional company who does that. There are lots of companies out there that do that. One of the other important considerations is that the OSHA.gov has made it mandatory for some industries to provide personal protective equipment or PPE. And so an example of that would be the masks, the gloves, the face shields, the sneeze guards, things like that. So make sure you're checking that website to ensure that your industry does not have to have those PPE equipment, or do you have to have that PPE equipment for your employees? So make sure you're staying compliant there. Also, a hot topic right now is testing. So EEOC did issue guidelines to where they are allowing employers to do temperature taking of their employees and asking the employees if they have COVID-19 related symptoms. However, I urgently strong precaution here. If you plan on implementing either or both of these testings, there are some key caveat things that you need to do here. Ensure that you are performing the testing in a confidential setting. What do I mean by that? So the last thing you want is you have an office, let's say you have an elevator, and then you have an office right outside the elevator, and everybody's lined up to have their temperature taken. Well, the last thing you want is Susie Smith to have her temperature taken and then to be sent home because her temperature is too high. What you're going to have then is a bunch of employees starting to make rumors. Oh, did you see that she was sent home because she had a fever that was too high, or she's coughing, or so you don't want to start the rumor mill and you don't want to start that negativity. So ensure that you're doing this in a confidential setting. The other important thing about testing is while your employees are testing or waiting to be tested, you must pay them. And so keep that in mind too. Also, when you are doing the testing and you are recording the testing, you are supposed to keep that information confidential and you must record the testing information. My suggestion would be to have some type of spreadsheet where you have the employee's name, what testing you're doing, what date it was, what were the results, that kind of information. Make sure you are limiting who has access to this information. Maybe password protect the file and only give that password to a few employees. The other thing that you want to stay out of hot water is don't single out employees. So don't just test the first shift employees. Don't just test the second shift employees. Don't just test the employees of Asian descent. So ensure that you are testing everybody. So if you do it for one, you have to do it for all. So those are some key things to keep in mind about that. One kind of issue that's a hot topic is called the antibody testing. So as of today, I strongly urge today, the EEOC has not issued guidelines for antibody testing. However, there have been false positives on the antibody testing. So my guidance would be don't do the antibody testing unless you have a surefire way that you know that those are going to be accurate testing results. If you do incorporate any other testing besides the temperature taking and the related symptoms testing, you must register those things with the CDC and other organizations before you begin those testing. So those are some kind of important questions. I know that's a lot of information about the testing, but I feel it's important. And if you're going to start doing that in your organization, these are some important things to keep in mind. So if you have questions related to the testing, go ahead and put those in the chat box and we'll get to them at the end of our presentation. So that's just the first page of what to do when to start. So the second page would include reviewing your current handbook. What do I mean by this? Do you need to amend your leave of absence policy? Do you need to amend your PTO and sick policy? Do you have a leave of absence policy? Do you have guidelines for requesting your leave of absence? Does your certain organization qualify for the Family Medical Leave Act or the ADA, which is the American Disabilities Act? So there are certain stipulations how a company can qualify for these certain laws, and we're not going to get into that. But again, ask your professional, HR professional or your lawyer for those certain things. Excuse me. But I want to talk real quickly on the attendance policy. So on the attendance policy, most of companies have attendance policies out there. And one thing I kind of want to talk about is maybe being a little bit more lenient on your attendance policy. So what do I mean on that? So let's say you have an attendance policy where people receive infractions if they're late or if they leave early or if they have unauthorized absences. On the attendance policy, if you have somebody who is repeatedly late, maybe have a conversation with that employee. Obviously pull them aside by themselves and have a conversation with that employee, kind of asking them, I see that you're having a little bit of attendance problems. What's the issue here? Well, lo and behold, what happens if so-and-so's mother or grandmother that lives with them is immune compromised? Well, they may be protected under these emergency sick leaves, which we'll get into in just a second. And so you need to kind of have a little bit of leniency when it comes to your employees. Now, that doesn't mean you want them to break the policy. You don't want to let them run amok and let, the Indians, whatever that saying is. But so again, just kind of police that policy, if you will. And if you have the flexibility, be very flexible. Flexibility goes a long way. And so one of the other things you want to talk about is your rehire policy. Do you have a rehire policy in place? So who are you going to evaluate who to bring back? Are you going to bring off your laid off employees? Are you going to bring off your furloughed employees? And so one thing I want to make clear here is if you have laid off employees, you do not have to bring them back. However, if you have furloughed employees, those employees need to be looked at first before you are hiring brand new employees, because the idea behind the furlough is that you furloughed them so they can keep their benefits, but they also have the mindset they are going to be returning back to work. So keep in mind, you want to do that caveat and kind of look at who was furloughed, who was laid off, those kind of type things. So some other key considerations to take into consideration is I-9 verifications, your background checks, and your drug testing. If you currently, so all employees, of course, have to do I-9. But if you have anybody that you are bringing back to the workforce, keep in mind that I-9 can last for a period of 3 years. So you can use that rehire or re-verify section down at the bottom on an I-9 form. You can use that information as if you're bringing somebody back. You don't have to re-verify the documents. However, if the document has expired that they originally used, then you would need to re-verify that particular document, but not the whole I-9 form. So one thing I want to touch on background checks and drug testing is if you do decide to rerun background checks and drug tests, you must do it for all employees. And so before you decide to rerun background checks and drug tests, maybe do some guidance here and again, document your situation. Are these employees on a particular contract where you have to rerun their background or drug test? Are you a federal contractor? You know, how long have they been away from the workplace? But keep in mind, consistent is fair is another thing you always hear us HR professionals say is be consistent and fair. So what you do for one, you must do for all. So those are just a few caveats on the I-9 and the background checks. So again, if you have any questions, feel free to put those questions in that chat box down below. All right, so one more thing that we should do before we bring our employees back to the workforce is to train. So train all your employees on appropriate cleaning. And so make sure you're having hand sanitizers, you have disinfectant wipes, you have tissues, and you're constantly reminding your employees to wash their hands and try not to touch their face. So the CDC website and OSHA.gov have some great handouts or printouts that you can print out and post all over your area about reminding them to clean their hands and things like that. One thing I want to talk about on this area is try to discourage your employees from using each other's workstations. So if you typically have employees that share workstations, maybe you can have one employee telework and the other one come into the workforce, or you have both of them telework if that's working for you. Make sure, we talked a little bit about your other policies before, make sure you're training your management on those leave of absence policies, and make sure your management knows about these new emergency sick leaves that were enacted on April 1st. Keep in mind there was a labor law poster that was produced around April 1st that needs to be posted. My suggestion would be to post those posters next to your labor law postings. Those do have to stay and remain up until December 31st, 2020, which is when this Leave Act still is in effect until. Also, as I mentioned, you also want to look at and train management on your LOA policies, your FMLA policies, and other things like that. So one thing you want to remind your management is negative comments about the FFCRA or the emergency sick leave laws or any kind of situation that's going on right now. So communication with your management is key. And so the last thing you want to do is have your employees spread negativity. So if you have an employee, you overhear an employee going, well, yeah, I tried to apply for the e-sick leave, but they wouldn't let me use it. Okay, well, let's pull that employee aside. Well, employee, what's really going on? What's the situation here? So make sure you escalate those issues to management or HR immediately, because the last thing you want to do is have a retaliation claim on your hands amidst all of this, trying to decide when to bring back people and when not. So a few more tips on how to bring back people and when to document is consider staggering your shifts and lunches if applicable. So if you have more than one shift and your first shift is 7:30 to 4:30 and then the next shift is 5 to midnight, maybe having that 30-minute gap will allow for not so many people to congregate in the same areas, especially around time clock entrances and exits. So make sure you're trying to stagger your shifts and your lunches if applicable. Also limit your traveling. So one of the key hot topic terms, if you will, or key terms right now is called Zooming. And so maybe you can limit the traveling in your contacts by having people do Zoom meetings or what we're using today, things of that nature. So try those kind of type options there. Also remember, keep in mind teleworking. If teleworking is working for you in your industry right now or your organization, maybe continue to let your employees telework. You know, and then there are key things to monitor there with your employees, making sure they're continuing to be productive and things of that nature. So just make sure, again, you are communicating with your employees and checking in with them on a periodic basis. So this is going to be a tough one. Close common gathering areas. So a lot of us like to gather around that water cooler or the coffee maker or the fridges. And so I would encourage you to discontinue letting people use these areas. If you're going to, you need to make sure you have those disinfectant wipes, hand sanitizers, and things like that. But to keep it easy and fair, I would just put big tape over that area and just not let people use those common areas right now. So one thing I want to talk about is compassion. Compassion always seems to get employers in trouble. Compassion is good because you're showing care and that you actually understand an employee's situation. However, right now, we can't really afford to be compassionate when it comes to an employee feeling ill. So if you are aware of an employee who comes into the workplace that is feeling ill, please send them home. It is so important right now that if they are not wearing a face mask or if they just aren't feeling well, that you must send them home. You know, I always say negativity spreads like wildfire. So if you have an employee that comes in and they're coughing and they're not feeling well and they just don't look themselves, pull them aside, have a conversation with them, and send them home. If they don't want to go home, then let's have an alternate conversation with them. But for the protection of you and your other employees, most importantly, send them home. And of course, the old adage where people are being quarantined for 14 days, or the new one is 72 hours fever-free. Make sure that that is also in your document handbook of how to reopen your work site, because if you have somebody who's tested positive or is in close proximity to somebody who has tested COVID, they must quarantine themselves for those 14 days. And as I mentioned before, make sure you respond to have a clean and safe work environment. So make sure you're doing that for your employees. So now that we've documented our plan to return to work, let's look at who to bring back to the workplace. So the first thing you want to do is, as I mentioned before, is you want to consider your furloughed or laid off employees. As I mentioned before, your laid off employees don't necessarily have to be brought back to the workplace. However, your furloughed employees, that may have a different situation there. Again, furlough means that they were furloughed for the meantime with the assumption that they were going to be brought back to the workforce. You also want to consider your higher risk individuals, those who are over the age of 65, maybe someone who is pregnant or someone who has immune compromised health system or someone with chronic health conditions. And also there are different caveats and different rules and policies in place for healthcare and first responders. However, I strongly want to encourage you to be very careful when it comes to considering these people that are at risk, because it could put you in a situation where you could possibly be discriminating against people. And so if half your workforce is over the age of 65 and you don't bring back any of those, that could cause a problem. And so again, just be careful. And this is where your documentation is going to come into key, to where you've thoroughly looked at everyone's background. Obviously, you don't want to go to employees and go, hey, are you pregnant? Hey, do you have any medical conditions? You can't ask those type of questions. But obviously, you can take into consideration the known factors that you do know as far as bringing back employees and who you should bring back and who you shouldn't. As I mentioned before, OSHA does state you have to provide safe and clean working environment. So make sure you have all that disinfecting equipment on a regular basis. Make sure you're doing that on a regular basis. And in fact, I would maybe have a task force that is in charge for once an hour. One person per hour goes around and wipes everything down. That would be a great idea. Make sure you're social distancing. Make sure you're wearing your protective equipment, those things like that. And also, as I mentioned before, try to be flexible. If teleworking is working for you, maybe continue to teleworking and try to be a little bit lenient on your attendance policies. Don't let your employees run all over you, but just try to think maybe 2 times before you react to somebody. And so this is a very highly contested topic right now. There has been some guidance and there's been other guidance that hasn't been given. So I'm going to talk to you about the guidance that has been given. So what do you do if an employee refuses to return to work? So most importantly, the NLRBA states that employees can refuse to work if they feel that there is an imminent danger in the workplace. Imminent danger is kind of hard to prove. However, the best thing you can do is to have a conversation reason alone for them not to return to the workplace. They must have a qualifying reason for them not to return to work. Your best thing to look at here would be the qualifying events underneath the FFCRA leave. And so for the emergency sick leave, there are 5 or 6 reasons. And then of course, under the emergency family medical leave, there's the 1 reason. And so again, I don't want to go over all of that stuff, but give us a call if you have any questions. So I wanted to give you an example of maybe why somebody would not be able to return to work. So I have an ill grandmother who lives with me who has cancer. Okay, well that particular grandmother is immune compromised. So if that grandmother has been told to stay at home in quarantine, that could possibly be a cause for that employee not to return to the workplace. Obviously, a couple more questions would need to be had with that employee. However, the next example would be, well, my child doesn't have any daycare. My child is 12 years old and there's no daycare, schools are out. I have to stay home and care for my child. If teleworking is not available to that employee, then yes, they would qualify for FFCRA and they would be able to stay home and refuse to return to work. Keep in mind, schools are getting ready to be out, but keep in mind that a lot of the daycare camps, a lot of daycares are still closed, a lot of camps are being closed or suspended. And so keep in mind the FFCRA policy or law stays into effect until December 31st, 2020. So the excuse or the reason for your employee's child not having any daycare does still play into effect. And so as I mentioned, and again, this is a hot topic too. If you furloughed or laid off any of your employees prior to April 1st, they do not qualify for the emergency sick leaves. So let me say that again. If you laid off or furloughed your employees prior to April 1st, when the FFCRA went into effect, they do not qualify for the sick leave laws. So keep that in mind. Again, if you have any questions, let us know. So just a couple other key points. What if an employee refuses to return? You don't have to pay them, and you don't have to let them use their PTO or vacation. Or use PTO, sick, or vacation laws. However, keep in mind that these employees may qualify for state or local sick leave laws. Luckily, San Antonio and surrounding counties don't have any mandatory sick leave laws, but just keep those in mind when it comes to your policies and reevaluating your leave of absence policies for these employees that can't return to the workplace. As I mentioned, keep in mind the emergency paid sick leave laws. They could qualify for those. And also, at the end of the presentation, you'll see a phone number to the Texas Workforce Commission. If you have an employee who refuses to return to work, and let's say they say, I'm making more money on unemployment, so I'm not coming back to work. Unfortunately, you're probably going to hear that a lot. I was doing some research for this presentation, and I saw in one state, I'm not going to mention the state, and it's not Texas, the average unemployment dollar amount paid out was $22 an hour. People were receiving $22 an hour for being on unemployment. That is ridiculous. So with that caveat said, if you have an employee that does not qualify for any of the emergency sick leave laws or anything of that, and they are just saying, nope, I'm not coming back to work because of unemployment, I'm making more money on unemployment, you need to for you to be able to. So definitely do that, because that should disqualify them. And I have should underline because, again, I don't work for the state of Texas. Neither do you. You might, I don't think so. But again, it's their decision whether or not that person's going to continue to receive unemployment. So next thing on the consideration list is benefits. So I'm going to talk over this kind of briefly, only because all of the people listening or those of you that are on the webinar today may or may not have benefits. However, there are a few key things to take into consideration. Your benefit plans and your retirement plans. And what do I mean by that? If you have employees that were off for an extended period of time, this may disqualify them from benefits or enroll in the benefits. Or you may have to do some other caveats. Depending on what your benefit plan documents state, you may have to do certain things with your employees. And then, you know, your furloughed employees are the employees that you're bringing back to work. Do they have to go through a re-enrollment process? If they missed any premiums, are those premiums going to be collected? Or if they're not going to be collected, is the company going to eat the cost of that? So it just really depends. One key consideration here that I want to remind you of, and again, every plan is different, so I'm just talking very broad and general. Employee that was previously full-time, but you're bringing them back to a part-time status, this could cause their effectiveness to qualify for benefits. So again, you need to check with your benefit broker or your HR professional to see if they qualify for benefits or if they continue to qualify for benefits. So as I said, I just wanted to touch over that briefly and just give you reminders to keep in mind when you're considering bringing back your employees. So now that we've documented our plan, we've talked about how and who to bring back to the workforce, how are we going to keep these employees safe and how are we going to keep a healthy work environment? So as I mentioned before, the best thing to do is to take a proactive approach to any of this stuff. So frequently clean your areas. Some of my ideas, like I said before, would be to maybe have washing their hands, their arms, their necks, any body parts that were exposed. Make sure they're washing those areas. Make sure you have plenty of soap. Make sure you have plenty of hand sanitizers, and make sure that stuff is available to your customers. I was talking to one of my clients earlier today, and one of their employees is concerned about coming back to work because they have a lot of walk-in traffic. So I was like, well, here's my idea. Put a sign on the door that says, we are happy to help you. Please call to make an appointment. I was watching the Today Show this morning, and they were interviewing the CEO of Best Buy. And they actually have made it an appointment only. So they actually encourage you to call, go onto the website. If you walk up to the store, there is also a sign, and they actually stop you and say, hey, go ahead and please make an appointment. And so I would try to take that caveat and put that into your organization. Not all organizations allow that or can do that, but that's what I would do for some organizations where you could limit the foot traffic. And as I mentioned before, visit the CDC and the OSHA.gov websites to print out your signage and make sure that you are posting that signage. And when I put screen employees here, I don't necessarily mean the temperature taking and the systems and the symptoms trackers that we were talking about earlier. What I mean by screening your employees who's here, of course, yes, ask them how they're feeling, how are you doing? But again, communication with your employees goes a long way, and communicating with your employees will help them re-engage and feel like they're actually mean something to the organization. They truly are a part of the organization. So that's kind of what I mean by screen employees there. So now you've decided when to open, and how do I get my employees to stay re-engaged? So obviously there's a lot of topics, a lot of literature out there about re-engaging the employees, but I found one particular website that had 16 tips on it that may be able to help you. And so I'm not going to read all of these to you. I just want to touch on a couple of them. So one of the things is, as I mentioned before, is have meetings with your employees on a maybe weekly or bi-weekly basis. One of the things we do at eESI and the HR department is that we have weekly meetings. And so this really builds a lot of camaraderie among the team members. Sometimes we laugh, sometimes we cry, sometimes we gripe, and sometimes we talk about what's going on in the organization. And so it's a safe place to have and come and bring our legitimate thoughts and feelings to the workforce. So it's nice to be able to have a safe place for you to be able to talk like that. One of the other key things I want to talk about is setting goals together. Sit down with your employees and what are their goals? It doesn't have to be just work-related goals. If you've ever heard the acronym SMART, S-M-A-R-T, try setting up SMART goals with your employees. Also, when's the last time you sat down with your employee and asked them what their hobbies are? Maybe their hobbies will create opportunities for them in the workplace. As I mentioned before, let's look at that flexibility. Is teleworking working for your organization? 9 to 5 age is kind of gradually disappearing, and so a lot of the times we need our flexibility to be able to be at Bobby's baseball game or Susie's recital, things of that nature. So one of the other things I want to talk about is praising mistakes. So the key here is management should embrace mistakes and continually remind the staff that they're allowed to make them with the caveat that you are learning from your mistakes. So that's the important thing, is that you learn from your mistakes. And of course, the old adage, you have 2 ears and 1 mouth, so make sure you listen appropriately and you listen to your employees. Not listen to respond, but listen because you care what they are saying. Disengaged employees are not a lost cause. If you employ just 1 or 2 of these working practices above, you stand a far greater chance of developing employees who are engaged, creative, and unafraid to make a difference in the workplace. So in wrapping up our conversation today, as I mentioned before, document, document, document. And lack of information breeds fear. So inform your management and your employees of what your plans are to return to work, who you're going to bring back, how you're going to keep the workplace safe, and also how you're going to continue to engage your employees. Also keep in mind, unfortunately, COVID-19 is not going away, but the best thing we can do is create a proactive instead of reactive approach. And planning is key, and you can't do it alone. So make sure you involve all of your management team, and make sure you continue to work together as a cohesive team. And again, disinfect as often as you can. And as I mentioned before, I was going to give you some websites for you to be able to review. I mentioned several of these websites during the presentation. And so the fourth one down, the texas.gov COVID-19, that's where you can get that handbook and some other information that Texas has put out. And the very last one is the website that you would go to if you have an employee who absolutely refuses to return to work and there is no legitimate reason for them not to return to work. Last but not least, here is my contact information. If you have any questions, you can always follow eESI online. You can always find the Chamber online too. And again, I want to thank you all for your time today. I want to thank Maggie and the Chamber and those that joined us today for your time. Maggie, do we have any questions?
I am looking and nobody has put anything forth in the chat. So I would say if anybody does have a question, would you like to raise your hand or speak up? You could have just done such an awesome job that you answered all their questions.
I doubt that, but thank you, Maggie. Does anybody have any questions?
Wow.
No?
All right.
It's after lunch.
It is.
Before lunch.
So
everybody's taking a nap.
They are. So what I will do with everybody that has joined us today, I will forward this slide deck. I will convert it into a PDF for you and forward this on to you later today. But I just want to thank you again for joining us. We hope you found this very informational. And as you can see, make sure you take a note of Sheila's contact information so that if you do have any questions once you do receive the slide deck that you can ask. Oh, wait, we have one raised hand. Brian, go ahead and unmute yourself. You can ask your question.
Sheila, do you have any recommendations you can provide for individuals that may have been laid off or furloughed due to the COVID-19 pandemic that are refusing to come back to work due to the financial circumstances involved?
So Brian, I just want to make sure I understand your question. Are you asking for advice if they are on unemployment?
If they're collecting unemployment, they're receiving the federal stipend as well. So they're getting Texas as well as the federal. And an employer says, hey, we're ready to open our doors. We need you to do this. And they say, hey, I'm not ready to come back. What would your recommendation be in that situation?
Great question, Brian. And so I think it's, again, communication is key. You've got to talk to your employees. Why are you refusing to return back to work? And you don't want to be so hard pressed that you are having, what's the word I'm looking for, that you're having a bad conversation or an uncomfortable conversation with your employee. And so if it truly is that they are just afraid, there are people who are recluse, there are people who have become comfortable in their work environment at home and they want to stay home. And so the other thing is that unemployment is not going to last forever. And now it the industry, if you will, kind of flip-flops. So before there were so many employed people and unemployment was so low that it was so hard to find people to fill niche jobs or even just everyday jobs, if you will. Now it has reversed. Now you have so many workers that are unemployed that for every one position, and I'm making this number up, but for every one position, you could have thousands of people apply for one position. You don't want to be those thousands of people who are not getting a job. Be proactive. Have someone review your resume. Have someone give you some interview tips. Do a mock interview. So I would strongly encourage you to revamp your resume. Definitely, I encourage you to go back to the workforce. Your employers need you. We need you. The economy needs you. So I would definitely encourage to be proactive and try to get yourself out there. And LinkedIn is fabulous nowadays. If you don't have a LinkedIn page, I highly encourage you to get a LinkedIn page. If you don't know anything about LinkedIn, it's basically a digital resume is kind of what it is in an essence.
Okay.
Brian, I hope that answered your question.
Thank you.
That was a great question. Anyone else? Doesn't look like I have any takers, Sheila. So once again, thank you again for joining us, and we hope you have a great day, and make sure you make a note of Sheila's contact information so that you can reach out to her if you have any questions. You all have a great day. Bye.
Thank you, everyone. Bye. Stay safe and healthy.